and television. Never a dull moment this summer on Ben Television, Bridging the Gap channel.
Watching Ben Television, the Bridging the Gap channel.
Hello, good evening viewers. You're welcome to Politics with KO, and it's another Thursday, your Thursday, where we discuss issues concerning Nigeria, and we want to talk today about the doctor strike. It's been almost 3 weeks that Nigerian medical doctors went on strike, demanding better pay, better condition of service, and also asking for more money to be put into the healthcare sector. You know, we're saying the life expectancy rate in Nigeria is between 49 and 50. I'm not sure, but we were going to have in the studio later Dr. Douglas, who is a UK-based brain surgeon, is going to come and tell us about his perspective and what is actually happening regarding the Nigerian Medical Association. And then we have from Nigeria, again on this program, who is in the studio, Ba Aye, who is a veteran in the labor movement. He actually belongs to the Medical and Health Workers Union in Nigeria. But aside from that, there's been a lot happening in Nigeria. There's been cross-carpeting, people moving in and out of the PDP, people moving in and out of the APC. But the shocking one is that we have a big fish from the APC. The former Borno State governor is moved to the PDP. So he's no longer a Boko Haram sponsor. He's now an honorable member of the People's Democratic Party. As a matter of fact, a spokesperson for the PDP said it's an act of patriotism for the former Borno State governor, Bunu Sheriff, to become or join the People's Democratic Party. So maybe there are no difference between the PDP and the APC, as they say. But I would want to assure you that we also went to Scotland, really, to ask about what do they know about Africa. That's going to come up in the program. Let me just take you straight to Ngozi because she's got a couple of things for us. Ngozi, you're welcome.
Thank you, Kay. Yes, a couple of things, like you say, has been happening in Nigeria. One of them, of course, being, did you know about the Nyako's impeachment? Mm-hmm. I'm sure a lot of people know about it. And having Mr. Nyako impeached, the national chairman for APC, John Odige, is saying that he blames the president completely for this impeachment happening. He's saying that he's bastardized the army, the police, the court, aviation, and electoral commission, and now he's moved up to the next level. This is quite a big accusation, as far as I'm concerned. But Odige carries on to say that every impeachment or threat of it in recent times has the imprint of President Jonathan on it. I'm not sure how that story is going to end, but please tweet us and let us know what your thoughts are on that one. The next thing that happened recently of interest is that Malam Ibrahim Shekaru has assumed office as the Minister of Education in Nigeria. Don't forget that Rukiyatu Rufai bowed out of office in 2013, I think it was in September. And since Shekaru was confirmed, there's been mixed reactions to his confirmation to office as the Minister of Education. Some people are saying that they don't think he fits in because they think that whoever takes on the job as Minister of Education should have the passion for it. Others are saying that they think he fits in very well because he used to be a teacher. Again, not very sure where most people stand on that one. But one thing I do know for sure is that the ASU are definitely looking at him to see if he's going to uphold the agreement that was reached with the union and see if that agreement will be maintained. We'll keep an eye on that one and we'll let you know. There's a few other things happening, but for now I'm going to really move on to this, the girls who are missing, the girls that were kidnapped by the Boko Haram. So on Saturday, it's going to be exactly 100 days since these girls have been missing. And so far around the country, both here and back home in Nigeria, there's been a lot of protests and rallies going on that's been happening in quest to ask the government to do more. As a matter of fact, Malala did go to Nigeria. Malala being the girl that was shot in the head by the Taliban a few years back, did visit Nigeria and visited the president, as well as some parents of some of the missing girls. And she was urging the president to do more about finding these missing girls. In the meantime, like I said, because it's going to be 100 days exactly on Saturday, there's been a few rallies that's going on. But there's another one coming up on Saturday, and one of the organizers, Jenny Okafor, is online with us. I'm not sure if she's online yet. Jenny Okafor?
Hello, good evening.
Oh, hi, Jenny. Good evening. Thank you for joining us.
Thank you for having me.
So this missing girls thing that's been going on, the Chibok missing girls, on Saturday it marks exactly 100 days since they've gone missing. Could you tell us what this rally that you're part of the organizers is supposed to be doing for the missing girls?
Thank you so much. It's actually on the 22nd, which is Tuesday next week.
Oh, I beg your pardon.
It will be exactly 100 days. And as you very much know, 100 days is a very significant day and number in politics. And we thought that it's very important that we use that opportunity to remind the world that these girls are still missing. We must not relent on the efforts to find them. The international communities have been very, very helpful. And I strongly believe that without their involvement and the outcry all over the world, it would have been business as usual, and these girls would have gone forever. But as you know, a lot of other world significant events are happening. They are very newsworthy. They are overtaking a lot of news events. And one thing we don't want to happen is to lose the momentum, because Bring Back Our Girls has been a worldwide phenomenon. Everybody is talking about it, and even in the White House, people are canvassing for these girls to be returned. We want it to remain that way until these girls are back.
Okay.
And the reason why we're organizing this event is that this rally is a very peaceful rally. We are not anti-government or anti-any tribe or religion. We're just simply gathering together to say that we stand in solidarity with the parents of these girls, and we stand in solidarity with the government of Nigeria, but we need them to please do more to bring back these girls.
And Jenny, you know, thank you for that, but you know that there's been quite a few rallies that's been happening in the past few months regarding these missing girls. What is it you think that means that a lot of people are just busy doing very, very different rallies as opposed to coming together as one massive group?
Yes, it's very, very good to come together as a very big group, have a big shot at it, and then, make the whole world know that people are still looking for these girls. But one thing we must not forget is that if we have one significant day in history where the whole world calls for these girls to be returned, and everybody goes back to bed and forgets about it, that is the end of the matter. So I am very much in support of the various groups coming out on various days to campaign and asking for these girls to be returned, because it keeps them in the news.
Okay.
For instance, my women's group, the Nigerian Women in Diaspora, we have made it our responsibility to ensure that on the 14th of every month, we will gather in front of the Nigerian embassy to protest, just to demonstrate our solidarity and say, look, don't forget our girls. So I think the campaign is gradually moving from bring back the girls to please don't forget the girls, bring them back.
Okay.
So it's very, very important.
Hi, what's your name?
Rory.
And can you just name me 3 countries in Africa that you know well?
3, Nigeria, Kenya, and is it Dominican Republic in Africa?
Nigeria, Zimbabwe, and there are many.
That's right.
Nigeria, Ghana, Djibouti or something like that.
Okay, that's fine. And what do you know about these countries?
Namibia, Kenya, Uganda.
Nigeria, Ghana, and I don't know.
Okay.
In Africa?
Yes.
Yes. Anywhere? Yes. Oh dear. Johannesburg, Cape Town, Ghana.
Zimbabwe, Nigeria, and Trinidad.
I know of Angola. I know of obviously Morocco, because I went there in business, and obviously South Africa.
Okay.
But there are so many countries, and you caught me offhand just now. But
that's not a problem.
But no, it's. I'd have liked to go to Angola because I did a lot of business there with Scotch whisky. Yeah?
Oh, okay. Oh, fantastic. What do you know about those countries?
They're nice countries with nice people and intelligent people also, and very sociable, very friendly.
And what do you know about those countries?
I know Nigeria is very oil-based. Kenya is very, from what I've been told, there's lots of safaris and stuff there. I don't know much about Dominican Republic. I've just sort of heard of it.
Okay, that's fine.
I know many things about those countries. I've visited them.
Okay.
I've been to them. I worked in Kenya, I worked in Uganda, and I also took a missions team out to Namibia with the church that I was in.
Oh, fantastic.
I only know them through work. I work at the university, so I know that we get a lot of students coming. I don't know, like, if you guys ever studied here or anything, but we get a lot of students coming over from the countries to study oil and gas and things like that. So I know that Nigeria is big for oil and gas.
Oh, fantastic.
I've been to South Africa. Okay. Had a lovely trip. Ghana, just what I've read and heard on news and so on.
Okay.
Some are poor, some are very affluent.
Well, it was so long ago now. It was mainly through agents and whatever, but I went to North Africa, but Morocco, that was with my original company, Seagram Distillers, that was Chivas Regal whiskey.
Oh, okay.
So I went there, but then the business changed, and then I go to many other countries all over the world. I think it was 55 different countries.
Do you think that Britain and UK does enough regarding foreign aid for Africa?
That's a great question. There could always be more, but I think, certainly in times of crisis, I remember a particular period when there was huge floods in Mozambique a number of years ago, and Britain responded and sent a huge amount of aid out to Mozambique. Yes, there could always be more. I think the challenge becomes when prime ministers of these countries perhaps don't use or are perceived as using the money in the wrong areas. Where the aid should be going, it doesn't always get there.
UK does enough regarding aid that it sends to Africa?
I think, yeah.
Interested, nothing like that.
Yeah, I think there's a good amount of aid goes over, yeah.
I don't really know probably enough about it to comment, but I think probably we could do more in a lot of situations.
Yeah, I think they contribute quite a bit, but I think it should be one of these things that everybody should be helping. And also within Africa, everybody's got to help back the way as well, because I know so many people from Africa who live in Aberdeen here and who work in the oil industry, and some very good friends. So I've got a very good circle of friends of all nationalities.
Oh, fantastic.
Yeah.
Well, thank you very much today, and have a lovely day, okay? Thank you. So there it is. We've heard from the members of the public in Scotland, Aberdeen, and next time we'll be in a new location. So thank you for joining us here on Politics with KO, and I'm Sarji Boltman.
You're welcome back to Ben TV, and it's your program Politics with KO. And can you imagine, name 3 countries in Africa: Uganda, Trinidad, and Serbia. And only God knows how many Africans can name 3-4 countries in Europe. But tonight, it's about the Nigerian Medical Association. Nigerian doctors have been on strike since the first day of this month, if I'm correct. And there's been quite crisis in the health sector in Nigeria. I just want us to understand the situation in Nigeria. And we're bringing back into the studio, first, a brain surgeon, a UK-based Nigerian brain surgeon, Dr. Douglas Okoh, who has been on this program before, because we want to share in his wealth of experience, and we just want to have an understanding of what's going on with the NMA strike. And then we have also in the studio again, Baba Aye, who is a veteran in the labor movement. He's actually in the Health and Medical Union of Nigeria. And we would get a lot from these 2 gentlemen. We just want to have an understanding. I want to welcome both of you, Baba Aye and Dr. Okoh. Now,
hi, Kayode.
I want to start with you, Dr. Okoh. Now, the Nigerian Medical Association strike, what's it all about? What are their demands? Why are they going on strike again?
Yeah, good evening, Kayode, and also good evening to everybody at home. So basically, yeah, the NMA, the Nigerian Medical Association, went on strike from the 1st of July, like you said, so just going to 3 weeks now. And basically, they have about 24 demands. And I think the first 5 demands are sort of their core demands, basically. Now, if you look at some of their demands, number 1, they talk about the deputy, what they call the deputy chairman of the medical advisory committee, right? Now, what they are saying here is that this particular post, what they're saying here is that this particular post has always been there, and that now the other healthcare professionals don't want this post there anymore. And in fact, what they're asking for is for 4 of these deputy or DC mark posts to be there. The other thing they're demanding for is that they don't want directors. Other directors in the tertiary healthcare system, and that's what the other health professionals are talking about. Also, there's stuff about their salaries, skipping some particular levels, and then one of the key issues is about the title of a consultant, which probably maybe I'll talk about later, saying that they don't want other healthcare professionals to have that particular title. And then last but not the least, about the relativity within the sector in terms of pay and stuff.
Okay, let me bring you back. You're with the Medical and Health Workers Union, and that is quite different from the Nigerian Medical Association. And what seems to be happening is a conflict between these 2 bodies, and Nigerians are paying for it. I actually thought it was about government's insensitivity. I never knew it was more about issues of what do you call a medical director post and what have you. From your perspective, what is happening?
Well, thank you very much, Kayode. I'll say that it's a complex issue, first and foremost, where and when workers fight for better wages and better working conditions. This should be defended by activists. However, there are some things to take note of, which Douglas has pointed at some of it. The Medical and Health Workers Union of Nigeria is one of the 5 unions that make up the joint health sector unions. And it's in a sense like the Nigerian Medical Association versus the rest of the team in the health sector. And this is not healthy. This is not healthy because healthcare delivery itself is a teamwork. And they are all working class elements to the extent of working within the health sector. Now, when you look carefully at the demands which Douglas has read out, what you have more are negative demands. By negative, I mean they are against the demands that have been made by the joint health sector unions, and which even the National Industrial Court has ruled on. I mean, for example, the issue of not wanting directors in the tertiary health institutions. This was because the health sector unions had won the right for people, directorship in the service, it's a rank, that's grade level 17, or CONHES 16, that's consolidated health salary structure, place 16. So in the ministry, people rise up to that level. You know, so what you're having is stunting people's growth.
Okay, let me bring in Dr. Okoh. So what is this, if an industrial panel has ruled on this, you know, what is actually the bone of contention with the medical practitioners? How does it affect them negatively in terms of the position of, say, a medical director?
I think, okay, let's look at things historically here. I think if you look at the way things have been in the healthcare system in Nigeria, from a political leadership point of view, from an administrative leadership point of view, i.e. in the tertiary facilities, and also at a technical or clinical leadership point of view. These are 3 different levels. What you will see is that over the last 30 years at least, doctors have been the ones running the shows, basically. And when you have a system in Nigeria, a rent system, where everybody wants his own share of the national cake, you get to a point where the other people within that system start getting disgruntled. And that's what has played over time. Now, but I think the key issue we should look at here is what we call international best practices. What are international best practices?
Yeah, I would like to know. How does it play out in the UK where you practice?
I think the first thing I would say is that there was this committee called the Alhaji Yayale Ahmed Committee, which basically brought all the different unions of health professionals together to sit down with them and say, man, what are the issues? This rivalry and stuff is causing lots of problems. What are the issues? And everybody talked about their own issues. And basically, if I can quickly read this, he said that he reassured everybody, this was Yahali after this, that he reassured everybody that there will be an unbiased arrangement and that things have been concluded for members of that committee to go to advanced countries to look at the way things are there, so that they can make recommendations to do things in line with best practices.
Okay, so in the UK, if I may ask, do we have health directors? Does it play?
Yeah, I'll give you an example of international best practices. So I'm going to look at 4 countries: the USA, the UK, Canada, and Australia. These are the people that we sort of copy things from. Now, if you look at these 4 countries, what you find is that usually you have a particular level of management called senior management, or the executive, or the executive board. And usually, the top man for that job is a chief executive. Okay. They either call him a chief executive, the president, or the executive director. And then within that senior man, within the executive, you have the different directors, sort of say. And I'll tell you, there are about 5 key positions in that director now, and I'll mention them to you, and it's very important that everybody understands this. Number 1 is medical. So you have a director of medical services. Number 2 is nursing. You actually have a director of nursing. Number 3 is an operating officer. Very, very, very key role. Number 4 is finance, and number 5 is human resources. So that is international best practices. Now, the issue is that when you have that level, you also have other levels down, which are the divisions, the departments, and the units. Now, the key problem in Nigeria is not about whether to have directorates or stuff. It's about devolving autonomy down to the different levels. And when I talk about autonomy, I mean financial, I mean in terms of their processes, making decisions and stuff like that. And that is what is missing in Nigeria. Now, the key word, autonomy.
Okay, now, those are fair points, wouldn't you agree, in terms of copying international best practices? Why should your organization, and we're going to open the line, I know I've heard that the phone is going off now, and we're going to have you're going to have a say, but I want Babaye to react to that. Why can't these 2 bodies come together? The people are suffering. I mean, hospitals, there is no one attending to patients. Is it not a fair point to say, let's go and adopt international best practices?
First and foremost, I mean, when you talk of these 2 groups, JOESU itself is the coming together of virtually all the groups, of which the NMA alone has been the one to step away from it. But a very, very important fact to note, which was salient in the argument of Douglas, is that what you have as the head of the tertiary health institution is a chief executive of that institution, who does not necessarily have to be a medical doctor.
I absolutely agree with that.
In fact, on the contrary, what the qualification required of such a person is a degree, a qualification in health administration, which could be studied by anyone in the other cadre. But the NMA insists that it should be a medical doctor, and it does not end at that. The same NMA that says that having directors, having other cadres rising to the peak of their careers as directors, wants to have 4 deputy chief medical advisory, chairman of the medical advisory. Is that not contradictory? If anything, and I think this should be placed on record and it is verifiable, JOESU has been the one that has articulated best practices, not only to the Yayale committee, but even before the Yayale committee, to the Justice Muhammadu Bello committee. So it's with regards to that, with regards to Surgeon General, and a number of things that the NMA is the one vitiating from the universally recognized.
Let's hear from Adaku. We've got a caller on the line, and Adaku, we want to thank you. Our first caller tonight. Good evening.
Hello.
Good evening. Where are you calling from, please?
I'm calling from Sheffield.
All right, go ahead, please.
When I'm bred in Nigeria, trained in Nigeria.
All right,
so
go ahead.
The problem of Nigeria as regards to healthcare. I want to say Nigeria has one of the worst healthcare and systems all over the world, and I'm really surprised that up till now the doctors in Nigeria don't want anything good for the citizens. And I'm just wondering why a doctor should be asking the question, why should other people answer consultants? I mean, are they the ones that formulated the English word? Don't they know what the dictionary means, the meaning of consultant? Over here in the UK, we have consultant pharmacists, we have consultant physiotherapists, we have all different kinds of consultants. I heard someone say that the doctors have been running the shops in Nigeria. That is why we've been having high infant mortality rates. We've been having women going to put to bed and they lose their child and they lose their lives because of that. Why can't we utilize the healthcare forces that we have in the healthcare system? We have pharmacists, we have doctors, we have nurses, we have physiotherapists, we have different people. Why can't we use them? I heard a doctor in Nigeria saying that a pharmacist is actually a dispenser. How can you call a pharmacist a dispenser when we study for 5 years? We do maths 111 and 112, which the medical students never do.
Okay.
They're the ones that calculate the doses. We are over here in the UK. I advise the doctors on what to prescribe. They call me and ask me, what dose do I give to this infant?
Okay, I want to thank you. Thanks so much.
Nigeria don't want to utilize this skills. That's why they're killing people in Nigeria.
Yeah, thanks for
wrong medication, and people are dying.
Thanks for your call, and we want to thank you. I've got a text message which says the Nigerian president is not interested in doctor strike for whatever reason. Is at the moment asking for an international loan for $1 billion to fight Boko Haram. So I think nobody cares about this medical strike anyway. It's just a waste of time. That is a text message from London. He calls himself MAD. We don't know. So we've got that argument there.
Well, the truth is that, unfortunately, I'm a doctor, but I agree with most of what Adaku is saying. I think just to support what Aye just said, right? If you look at this executive body, this senior management I talked about, all the positions there, only one of them is usually a doctor, and that is the medical director, right? Only one of them. So let me bring one other key issue here. Okay. Now, the issue of the consultants, where the medical doctor says, oh, no other person can be a consultant, I don't think that is the question that we should be asking. Okay. In fact, all the demands, most of the demands are about more of selfish, oh, what do I get from this national cake system? You understand? Even the Johesu is guilty of that as well. Okay. You understand? And that is my problem with both parties. Okay. You understand? There are more fundamental issues to the healthcare system.
Because I'm actually quite surprised. I thought I would be reading about the state of healthcare, the fact that you go into our hospitals, they are more or less like a pathway to the mortuary. You know, it's a shock. It's shocking.
Let me shock you with some staggering statistics. Right now, Nigeria has a population of about 170 million people. Right now, in the Medical and Dental Council register, they have just over 47,000 doctors registered under this, and that is registered. Some of them are outside Nigeria. 47,000. Now the UK
47 or 47,000.
47,000. Just 47,000 doctors on the register in the Medical and Dental Council of Nigeria. 170 million people. Now in the UK, with a population of 63 million people, right? They have a population of doctors registered in the General Medical Council. 260 million. Sorry, 260,000. Wow. So the number of doctors in Nigeria is about less than 1/5 of the doctors in the UK. Now, did you get that?
Even with the small population.
Even with the small population. So now the key issue is when you talk about, Johesu wanting people to be consultants, and NMA saying, no, we don't want Johesu people to be consultants. That is not the issue. The issue is, in a country where you have very few doctors like that, it has to come to a point where the other healthcare professionals have to expand their roles. You understand? They have to expand their roles, and the expansion of that role will mean not just whether someone becomes a consultant. It has to be about need, and it has to be about creating value within the system.
Before Babaye comes in, I've got another caller on the line. Hello, good evening.
Good evening, Kayode.
Good evening. What's your name and where are you calling from, please?
Ade is my name, calling from London.
All right, go ahead, Ade.
Kayode, thank you for this topic, for this important discussion. The point is, the moment everything is politicized in Nigeria, this is where we're going to end up.
Absolutely.
Look at the statistics
Dr. Okoh
is giving there. If we have out of the 240,000 doctors we have in this UK, I'm telling you, if we go deep into it, at least nothing less than 5,000 will be Nigerian doctors.
Absolutely, that's correct.
So, you see, like the email you read out as well, Nigerians are looking for $1 billion loan to fight Boko Haram, rather than concentrate on knotty issues like this. The president is not saying anything about the doctor strike in the last 3 weeks. I can imagine the doctor should say we want to strike in this country and what David Cameron will be doing now. But having said that, you see, it is high time we begin to sensitize our people in Nigeria that, look, we have a long way to go. There are certain things that is fundamentally wrong with the existence of Nigeria. We all cannot continue sitting down outside this country and then be talking to them in Nigeria. There are things we need to move forward in Nigeria. Everything needs to go back to how we select our leaders.
Okay.
That is very, very important.
Okay, that is key. That is key, and I also want to thank you for that. We also want to mention the fact that we've got some Twitter messages coming in. Before I read that, I want to read this text message. It's from Abiodun. Abiodun says, with President Jonathan, nothing is working in Nigeria. He's busy fighting to stay in power, wasting our money. Which professionals are also now joining in to share the national cake, as Dr. Okoh has mentioned. That's Abiodun. Abiodun, thanks for your text message. I want to ask Baba Aye now. Now, what's the effect of this strike on the economy?
Before I come to that, I think there's the need for a response to what Dr. Douglas said. Joesu's own response is a reaction to years of what is considered as marginalization by the doctors. And historically, the roots of this can be traced to when Professor Olikoye Ransom Kuti became Minister of Health. And, you know, he marginalized the roles of the different cadres apart from those of doctors. So it hasn't always been like that. I think it is important to stress that than to make both parties seem to be equally the aggressors. What we would want at best is for everybody in the health team, the doctors and the members of JOESU, not only to work together for a better healthcare delivery, but where and when we have to fight together as a body.
Okay.
With regards to the economy, I think health is actually more than wealth. When you say health is wealth, and you can't overemphasize the importance of health. And that is one reason why JOESU unions, we find it very, very difficult to go on strike. Incidentally, the NMA has gone on strike like more than 6 the number of times any and all added together JOESU members have done. Because we realize that when you go on strike, human beings lose their lives.
Okay. So you think it's insensitive that they should go, but I'll have a caller coming now. I've got Oluremi on the line. Good evening, Oluremi, and where are you calling from, please?
Oh, good evening. My name is Oluremi. I'm calling from Kent.
Okay, go ahead, please.
Oh, I thank you for this discussion, and I thank exactly what the doctor has put before the nation. Is statistics about and the position in the medical rank in this country, and taking into consideration like medical doctor and nursing director and so on, and HR, human resources. I think the Nigeria government and the Medical Association of Nigeria have no interest about common people in Nigeria. They all after money, and that's why they are fighting this issue.
Okay,
people in the diaspora, you have something to do, and that's what doctor has said is what these people and the doctor can advise the Nigeria government to take into consideration instead of what they are fighting for.
Okay, all right. Thanks so much for that call. I've got a text message, but before that text message, I read that text message. What's MANSAG? I keep hearing about MANSAG. MANSAG, who are they?
Well, MANSAG is the Medical Association of Nigerians across Great Britain. Basically, it's a body in the UK here. It's an association, the body of Nigerian doctors within the UK, and also other healthcare professionals are part of this body as well. The thing is, yes, I'm speaking here.
And I would want you to touch on the effect of the economy too.
Yeah, I'll definitely do that, Kayode. The MANSAG, I'm not speaking on behalf of MANSAG here, but I do expect that MANSAG, being a body of Nigerian doctors who have families in Nigeria, should be making should have a position or be making a statement regarding this. And so I would expect that the president or the leader, Mr. Jacob Okoh, should be doing that. In fact, I wouldn't expect people like Ben TV, the representatives of Guardian, Vanguard, to be getting across to Mr. Jacob Okoh and the team and asking them, what is your view on this? Yeah. So, but regarding the related to the economy, in fact, if you look in the World Economic Forum recently in Nigeria, you look at most of the discussants at different sessions on that, especially the guys from the Western world. And they always talked about the healthcare system when they talked about the economy. So it is key. In fact, when you talk of if you talk about 5 things in the national economy, the things you talk about are power, health and education, infrastructure and technology, and last but not the least, technology and information. So it is key. It plays a central. The problem is that if you look at the Western countries during their electionary campaigns, health is always one of the top things. But in Nigeria, it's second place. You understand? There's one other key thing I want to talk about here, and I think Oluremi talked about it: leadership. You know, I told you the last time when I came on this program, I said we have round pegs in square holes. Look at the leadership of the enemy. The present leadership of the enemy, headed by Dr. Lawrence Obembe, came in May 2014. And what was the first thing that he did? In his press briefing, he said that he wanted number plates, special number plates for all doctors within the country. It's very disgraceful. I felt shit.
That's quite amazing. I'll take this text message. I've got this message from Chris. He says, our hospitals are gateway to death. Clueless doctors. I did my dad's operation and they operated on the wrong eyes because of greediness. I'm totally ashamed of being Nigerian. I've got another text message from Joe. Joe says, it's a long one. The problem with Nigerian is blaming the government with regards to what the last man just tested said. I think the doctor just said the parties are fighting their selfish interests. So why blame the president? We should be solving the problem, not adding to it. That's Joe. And I've got a caller on the line too. If you can hear me, good evening, and what's your name, please?
Yeah, good evening. My name is John. Are you hearing me?
I'm hearing you. Where are you calling from, John?
I'm calling all the way from Kayode.
All right, go ahead and make it brief, please.
Yeah, my own submission to this is this. When the foundation is not good, anything we build upon that foundation are not good. Absolutely. You see, the foundation of Nigeria as at now is not good. Let us go back to our original government. We are all Nigeria, but let us all go back to our original government. Okay. Let each region do how they want things to be done by themselves.
Okay.
I believe that will solve the problem of Nigeria.
Okay, that's an interesting point, and I've got Baba here. It's not just in the medical union, he was also a political activist.
No, it wasn't. I am not.
He was still an activist. So yeah, John, because I said you're going to be brief,
okay.
John has a point there that all these problems we're having has got to do with the structures of the country, you know. Like if we don't have a good structure, you will have medical crises, you're going to have Boko Haram, insecurity, and what have you. From your point of view, I want us to digress on that because there's a political point to everything that happens in Nigeria.
The issue of politics is central to virtually everything because it's about who gets what, when, where, and how. And it is, however, very important to stress the fact that the most fundamental thing with regards to politics is not where you come from, I mean, geographically. It is more a question of your class. All these things we are saying, the rich, the high and mighty in Nigeria, despite the state, the pitiable state of the health sector, they can fly down to Western countries like this to have first-grade.
And that is where leadership needs to come.
If I am a Nigerian doctor watching this program now, I will be saying, that's easy for you to say. You live in the UK, you practice in the UK, and you work under best practices. But they are the ones working under very difficult circumstances.
Not only the members of DRESU too. Health institutions, which we're talking about. But I also want to point out a discrepancy now. This issue of realizing the state of the nation now. As of May 1, DRESU declared a strike action that was to start on May 15. The only reason it was called off was because, you know, of the need for the healthcare system to, you know, respond to the bomb blast and all that. And we expected at least a modicum of the same from the enemy.
Okay, before I'll let Dr. Okoh come in there, but I've got Ronke, who is going to be our last caller for today, and the text messages have been going on. I can't read all your text messages, but just keep trying next Thursday. Ronke, good evening, and you're welcome to Politics with KO.
Hello, good evening.
Yeah, where are you calling from, please?
I'm calling from London.
All right, go ahead, please.
All these things that are happening in the Black African nations, they are very disheartening. They are very, very, they make us sad. And I believe very strongly that our leaders are being chosen by the devil. That the devil controls them and they dine and wine with the devil. And I will use this opportunity to urge the Christians who believe in the Almighty God to rise up and start praying in their closet. For the Black
Well, thank you so much for that passionate intervention. And I'm actually quite sure that we have a rising Christian faith. Multitudes go to the expressway every weekend. Almost 1 million gather. And it's a wonder why these prayers have not moved a mountain. And Dr. Okoh, how come, you are a medical practitioner, you're a surgeon, I know you're a Christian too. How come these jet riding pastors, they've not been able to turn things around in terms of moving mountain and chasing away bad leadership?
To tell you the truth, Kayode, don't let me get started with the pastors, because they might call me a pagan or something like that. That's another issue altogether. Well, I think with respect to the question you asked Aye initially about the ministers of health and stuff, I'll call a few names quickly. Jeremy Hunt, Sylvia Bowell, Rona Ambrose, and Peter Dutton. These are the ministers or secretaries of health of the UK, United States, Canada, and Australia. None of them are doctors.
Wow.
None of them. In fact, they read things like philosophy, politics, political science, and business.
So they have a system. That's the truth. They have a system.
We're talking about international best practices. So I just talked about those 4 countries.
So if we have a system in place, it doesn't matter if it's a medical doctor.
Yes, it doesn't. The enemy wants to eat his cake and have it at the same time. It's the leader of the team. That is not beyond dispute, but it wants to replace itself for the team. And when you look at it, the fact that Lionel Messi got the golden ball, he didn't give Argentina, the World Cup. So nobody is doubting the role of the medical doctors as the leader of the team. But the team is larger than the leadership.
Let me get something right here. I told you before, there's political leadership, and there's administrative leadership, and there's technical leadership. Clinical leadership is where doctors hold. Exactly. That's the team. You understand? At the level of political leadership, it is the president or governor's prerogative to boot anybody. It must not be a doctor.
And how about the issue of teamwork, really? Is there
I think the teamwork issue is just a concept that we need to embrace. Do you understand? Everybody within the team is indispensable.
Exactly.
The doctor plays a central role in delivery of care to the patient, but all other health professionals also play very important roles.
I want to thank both of you for coming on this program. It's been very educative. And Dr. Douglas Babaye, it's good to have you here. I've got lots of text messages coming in. I cannot read them all. I just want to thank you all for keeping faith on this program. We are, my producer has said I should actually try and read 1 or 2. I've got, I am Tony. The problem with Nigeria is that the people in power are bigger than the institution. They are occupied with looting. The president is bigger than the presidency. Until changes come to Nigeria, I am afraid we have a problem. That is Tony. I've got Bayo Taiwo, who says doctors should be professional and they should act on humanitarian basis. I don't have any sympathies for them. They need to take care of their patients. And it's been quite a number of arguments in support of the doctors and against the doctors. We're going to continue with this conversation. Remember, we still have next Thursday. We want to thank you all for watching. Good night, and God bless you.
With Kayode Ogundamisi every Thursday from 8 p.m. to 9 p.m. on Ben Television. Never a dull moment this summer on Ben Television, Bridging the Gap channel.
Watching Ben Television, the Bridging the Gap channel.